65-year-old Suresh, insulin-dependent diabetic male, presents with episodes of confusion, dizziness, palpitations, diaphoresis, that is sweating, and weakness. What is the differential diagnosis? You can type in the comment box what is the differential diagnosis of this question. So the hints are given: insulin-dependent diabetic male, confusion, dizziness, palpitation, diaphoresis, and weakness. What is the differential diagnosis? "65-year-old Raghu presents with painless hematuria. He is a heavy smoker and works as a painter. Heavy smoker. What is the differential diagnosis? Type in the comment box. A 50-year-old man presents with complaining of chest pain that occurs at gradually diminishing levels of physical exertion. Here hint is given: gradually diminishing levels of physical exertion, as well as 2 recent episodes of syncope while morning walk. Cardiovascular examination reveals a blood pressure of 120 by 90 mm of mercury. Allowed crescendo-decrescendo systolic murmur, best appreciated at the upper right sternal border with radiation to both the carotid arteries, and a weak and delayed carotid upstroke. Hint is given: loud crescendo-decrescendo systolic murmur, upper right sternal border, radiation to both carotid arteries, and the main hint is weak and delayed carotid upstroke. An ECG reveals a left ventricular hypertrophy, and the echocardiogram reveals a bicuspid aortic valve with reduced valvular orifice, which is less than 1 centimeter square. A 35-year-old male victim of multiple blunt trauma is in shock because of splenic rupture. The patient is operated on and sent to the intensive care unit. The next day, he becomes short of breath, acutely short of breath. A chest X-ray studies shows diffuse bilateral pulmonary infiltrate, and ABG analysis reveals severe hypoxia. Now they insert a Swan gauge catheter. It is threaded through his superior vena cava, right atrium, right ventricle, and into his pulmonary artery. Shows a normal pulmonary capillary wedge pressure. What is the diagnosis? Here the hint is splenic rupture, shock, acutely short of breath, diffuse bilateral pulmonary infiltrate, and the ABG shows severe hypoxia, but the pulmonary capillary wedge pressure is normal. Type in the comment box what is the diagnosis. A 42-year-old man is diagnosed with stage 1 malignant melanoma on his left upper arm. Which of the following represents the strongest risk factor or factors for the development of this disease? A. First degree relative with melanoma. B. Light skin, hair, eye color. C. Total number of body nevi. And D. Poor tanning facility. And E. Both A and C. Six. A 46-year-old woman has previously had stage 2B melanoma removed from her upper back. She presents to the emergency department with dyspnea and is found to have multiple lung lesions concerning for metastatic disease. Prior to embarking upon chemotherapy for her disease, the presence of which genetic mutation is an indication for specific therapy? A. BRAF, B. CKIT, C. ERK ERK, D NRAS, E MEC. Type in the comment box the answer to this question. 7. A 62-year-old man presents to the emergency department complaining of droopy upper right eye and blurred vision for the past day. The symptoms started abruptly and he denies any antecedent illness. For the past 4 months, he has been complaining of increasing pain in his right arm and shoulder. His primary care physician has treated him for shoulder bursitis without relief. His past medical history is significant for chronic obstructive pulmonary disease and hypertension. He smokes 1 pack of cigarettes daily. He has chronic daily sputum production and stable dyspnea on exertion. On physical examination, he has a right eye ptosis with unequal pupils. His pupil is 2 mm on the right and not reactive, whereas the pupil is 4 mm and reactive on the left. However, his ocular movements appear intact. His lung fields are clear to auscultation. On extremity examination, there is wasting of intrinsic muscle of hand. Which of the following would be the most likely to explain the patient's constellation of symptoms? A. Enlarged mediastinal lymph node causing occlusion of superior vena cava. B. Metastasis to midbrain from small cell lung cancer. C. Paraneoplastic syndrome caused by antibodies to voltage-gated calcium channels. D. Presence of cervical rib on chest X-ray. E. Right apical pleural thickening with a mass-like density measuring 1 cm in thickness. The question may be big, it may be huge, but it is providing a lot of knowledge towards the proper diagnosis of the case. The more details are there in the question, the better will be the answer and easier will be to answer it. So never be afraid of the size of the question. So find out what is the answer to this question and type in the comment box. 8. Deficits in complement membrane attack complex C5 to C8 are associated with the infections of what variety? A. Catalase positive bacteria. B. Neisseria meningitidis. C. Pseudomonas aeruginosa. D. Salmonella species. And E. Streptococcus pneumoniae. So find out the answer and type in the comment box of this question. 9. Which of the following infectious organism is most likely to cause relative bradycardia during a febrile event? A. Pseudomonas aeruginosa. B. Salmonella typhi. C. Staphylococcus aureus. D. Streptococcus pneumoniae. E. Streptococcus pyogenes. 10. Chronic dialysis is associated with increased risk of healthcare associated pneumonia caused by which of the following? A. Acinetobacter species. B. Candida species. C. Methicillin resistant Staph aureus. D. Multi-drug resistance Enterobacteriaceae. E. Pseudomonas aeruginosa. Type the answer in the comment box and let me know what is the correct answer. We'll discuss this further.